Prodovite. Nutrition that gets in.
I've had the opportunity to know Dr. Norm Raymond for several years now, and such a class individual, incredible passion about health. He has read so many books and journals, and he is just a wealth of information. We're so happy to have him a part of VNI and what he can bring to the table for our company. So Dr. Norman Raymond, a retired OB GYN doctor out of Marysville in Columbus, Ohio. It's great to have you on the call, Dr. Norm.
Well, it's a privilege to be on the call. Apologies for being a little bit late. I'm up here in the Maine woods for a few days.
Yeah, well, I do know you're traveling. Yes, I know you're traveling, and you're up in the Northeast, but I know that you have really shown an interest to be a part of our great company, and just wanted to have you share, and maybe Bill would like to ask you a few questions as well, but just some amazing information that Bill just shared about being able to have our published paper now on the clinical study with Prodovite. It's just unbelievable. It's a wonderful time right now.
Let me make a couple comments, Norm.
Sure.
When I get the chance, even from the very first time that I met Norm at a hotel, we sat down at a breakfast table and began talking quite a few years ago before V&I was begun. Norm, I don't want to speak for you, but for me, it was a very similar phenomenon to when I got a chance to spend some time with Steve Kushner. And my perception of our meeting was two people that realized that they were involved in a common mission, something really exciting that had the potential to change lives, and were passionate about doing that. It was almost like two kids playing in a sandbox. That I'm going to use the word giddiness. I just was so excited about the opportunity of collaborating with you, and we really now have a chance with Victory Nutrition to do something so meaningful. And you and I had an interview with Steve Kushner, and then you and I had a chance to do a radio interview with Catherine Raker, and other events that we will eventually be involved in. It's just, I'm having so much fun literally tearing off the lid on conventional dogma and opening up new vistas of understanding and achieving new milestones in health that, I mean, what could be better than helping people improve the quality of their lives the way we're doing it? And I'm just thrilled to have you be a part of it. And I guess the first question is, the first time, having a medical, scientific, and I'm going to say educated, skeptical scrutiny of nutritional products, because there's a few of them out there, tongue-in-cheek, obviously thousands of them out there.
Yeah.
What has the transition been like to go from concept to the reality of what we have and seeing the results? And you also have some personal experiences in your mom and in your own health experience. If you just kind of give us a little bit of a background account of your perspectives sort of prior to this happening, and then as you've come into this, how have we enhanced the validity of this technology and your confidence in what it can do?
Being almost 30 years in clinical practice in traditional medicine, I sat once in my office and thought there's got to be more. There has to be more than just pharmaceuticals and surgery. There's got to be a better way. And I at that time, I met a few friends from a group called the American Academy of Anti-Aging and Functional Medicine. Functional medicine is where you get to the root of the problem. You just don't give another medicine to take away the symptoms, et cetera, and so forth. And I transitioned from that into really looking at nutraceuticals and looking at plant life and, what can help us, et cetera, and so forth. And I'll make this rather short. I then came across many companies, some, frankly, I'll speak truth in the air, who are bogus. But
really,
as you go along, there are more and more companies that have really good products. But the efficiency in the body, what they do, isn't as good as I had anticipated. And when I came across VNI and what you and
Steve,
Dr. Kushner proposed, and the very fact that there are a lot of good products out there, there are a lot of good natural things out there, but VNI has a way of actually getting into the body, assimilating into the body quicker and very effective, improving the efficiency of the body, was incredible to me. And I thought to myself, you know something? Nobody else has this. This is truly only VNI that has this technology. And I almost hate to use the word technology because it's so en natural. And it's an amazing, for me, that was amazing. For me, that made me say, look, I want to be involved with this. This is incredible. In fact, eventually this could turn around everything because of the way and the high percentage of nutrition that actually gets into the body, takes effect. And when I thought to myself, look, it gets absorbed down into the small bowel, then down inside and then inside the cell, and many of the constituents that are needed go right down into the mitochondria to give us energy. What better, I can't think of anything better than that. So from nature to my kitchen table, whammo, boom, it can happen. So for me, that's just exciting, and it goes on to be exciting, to say the least. And Bill, I'm dwarfed. I'm not going to go on. I'm really dwarfed by your knowledge in the sciences, and really excited that this company has somebody at the helm like you, because I know you're excited about it. It's an amazing road that we're on and journey that we're on together.
Yeah, it's amazing. Yeah, you tried some products. If you would give an account about your mom a little
yes.
bit. Your young mom.
Yeah, my mom just turned 90, and she has gone down that dementia road little by little, and has Alzheimer's. And we just saw her slipping away, and I thought, I'm going to give her some Prodovite. Why not? I mean, it's crazy. I'm taking it. Why not, Mom? And I didn't tell any of my brothers. There's 10 physicians in 2 generations of my family, and so my brothers are physicians, cardiologists, obstetricians, and there's internists in the family, and it just goes on. And I didn't tell them that I was going to give our mother Prodovite. So I gave it to her, and I gave it to her, standardly, once a day. She took it in the morning. And they walked in. They gave me a call, and they said, what happened to Mom? She's talking. She recognizes everybody. And I said, I turned to my wife, and I said, the only thing we've changed is we've added Prodovite.
She wasn't talking before, right?
No, she wasn't.
Yeah, okay.
She wasn't talking. And just her eyes, pardon me. Just her eyes. She couldn't, you could tell whether she recognized somebody. Right. Or not. And that all changed. And then, we went on, I think we went on vacation or something, and she ran out, and the nurse's station where she is at right now, they didn't call me. And then they called me later and said, she's not talking again, she's down again, et cetera and so forth. And I thought, the Prodovite. So I took it back again and gave it to her. And actually took a couple of bottles back, and she just perked up right away again. And this is like within 20 or 30 minutes after we gave it to her, She perked up. By the next day, she was talking again. And I'm also, by the way, I'm very excited about the new flavor, because she takes that even more readily, which is really great. So for me, that was huge. And I thought, it's extremely complex, as you and I would discuss the science, but it's really very simple.
Right.
Get more oxygen to the brain where it's needed. Your brain and all your organs, your organelles down inside the cells are going to work much better. So higher percentage of absorption, greater oxygen and water coming to where it's needed, and a better outcome. And that's what we look for in medicine, better outcomes.
Right. That's amazing. Now, I haven't spoken to you. I spoke to you once briefly earlier or later last week, but I know that if you don't want to talk about it, it's perfectly fine, but you've had some blood sugar challenges and some issues, and you've communicated with Steve a little bit more than with me, but you've given me a summation. Is it okay to give some changes in your health?
Oh, absolutely.
Okay.
Well, I'm going to talk mainly about Prodovite because I love Brain Award and the thiol as well, but the Prodovite itself as a cornerstone for me has helped me with my diabetes. If you have blood sugars above 300 for 3 months, the literature says you've probably blown out 80% of your pancreas. So I'm basically working on 20% of my pancreas at best. And that's only because of the stress factor of being an OB GYN, an outlying hospital where I didn't have residents and students, and I had to do everything. And so that meant even up to 72 straight hours working, which is crazy. But it took its toll on me. And so my diabetes is pretty advanced. Well, I'm taking Prodovite, and I'm sleeping better. I'm increasing my white blood cells to attack those things which are not good inside my body that need to be cleaned up, so to speak. And the upside of this is I'm more aware of my surroundings. I've got more energy. I'm sleeping better for sure. And it's just it's in the midst of changing my life for the better. No, there's no doubt about it.
Well, you were taking 1 ounce a day for a while.
Yeah.
And then you increased it somewhat, from what I understand.
I did. And I wanted to maximize. I wanted to maximize it. And I know it is true, like in medicine, just because you have a good response to something, it doesn't mean you should take 2 or 3 or 4 or 5, times a day. But for me, I had a certain regimen that I've worked with, and it's worked very well for me. And so when you have diabetes, what happens is everything that happens in the body eventually, as we get older, just happens quicker. Kidneys go, heart goes, coronary artery disease. I mean, you get the whole package. And so you have to do the best you can to control the blood sugars and to stay healthy. And that's and Prodovite's a cornerstone for me for that. There's no doubt in my mind after I saw what happened to my mother with Alzheimer's, with me, and with others who I shared Prodovite with. This is really good. It's a wonderful thing for us, for humanity. I'm not kidding. And the more we can get the word out there, the better, because people are going to do so much better on this.
That's amazing. That is absolutely incredible. I'm not going to make any other comments other than the fact that it is so deeply gratifying, immensely gratifying to know that you've experienced improvements in your health and have a commitment and passion to let other people, it's empowering. It's liberating for people to know that they don't have to be, and I'll use the word, in bondage to ill health as what do they call it, an inevitable byproduct of aging or chronic disease that we just have to continue to medicate. We really have a portal, a pathway, a doorway, an escape hatch to get out from underneath that bondage and start really giving, to find out what our bodies are really capable of achieving, because nobody's ever seen this kind of stuff before.
No. In fact, I was talking to my wife the other day, and I said it's amazing. Aerospace technology, we just climbed like crazy, and all other areas of technology. And you don't hear much about nutrition. You hear a lot about nutrition, I should say that, but you don't hear many extreme advances. This is a top drawer extreme advance
Right.
because you're getting more. Basically, you're getting more of the good stuff in, and your body's working better. All the mechanisms, like your liver has over 500 different mechanisms that it does. Well, if I can make my liver work better, and it's a filter system, my entire system is going to do better. My heart, my kidneys, my lungs, everything is going to work better. And when I know that this is not only working in the liver, but also in the kidney and in my brain and my lungs, and especially the vasculature. As you've mentioned before, there's over 60,000 miles of vasculature, arteries and veins in me. Well, if I can get that, which carries really the river of life for us, if I can get that working better, how much better am I going to be?
Right.
And I'm not, that old saying, I love about, I just don't want to add years to my life, but life to my years is
Right.
very true. I want to be around, and I want to be around strong for my grandkids and for my great-grandkids. And that's important to me. I guess it is for all of us. And this is going to help me.
Norm,
Simple.
I cannot begin to express my gratitude for you being on the call and for being a part of this and for giving me the opportunity for us to play together in the field of health and improve people's wellness is just a big, and I know Steve is exactly the same sentiment. We just thoroughly enjoy our collaboration. It's just so much fun. And I also will be eternally grateful to Lonnie Coulter for introducing us, because birds of a feather flock together. We are so blessed that you've become a part of our family. And I'm just looking forward to the times that we can continue to do some great things together.
Well,
so God bless you. Thank you so much.
Thanks so much. It's a pure joy. It brings joy. It's
Thank you.
phenomenal. Yeah.
Please stay on the line for just a few more minutes.